So I'd like to welcome Dr. Josephine Sauvage, North Central London ICB and Sustainability Lead, who will be leading the next session and chairing the discussion on decarbonising specialties at scale. Welcome, Josephine, in the panel.
Good morning, everybody. I'm really honoured to be here this morning and to be chairing the first session. Just to pick up on a few key themes from that fantastic opener. And I suppose the first thing that struck me was the slide that came up with the question from the BMJ article asking, so Mum, what are you going to be doing about climate change? And I suppose I'm here today because my son Thomas asked me that self-same question when he was very little. So we all have in this endeavour our own personal call to action, and I think this is one of the most important things that binds us, particularly in these times. So first of all, just to highlight a few themes which have been very important to me, it is about clinical leadership, because ultimately we are here to deliver great care to our patients, but also to advocate for the climate. And certainly one of the things that I found in the context of my work, this is about making it everybody's business, incorporating it into everything that we do on a daily basis, making it an opportunity to deliver net zero, but also to deliver great care. And most importantly, it's about hope, and it's about driving ourselves together towards taking action. So, in that journey, I've got some fantastic speakers who I'm going to welcome to the stage. We've got 5 minutes each, so we've got a clicking clock here in front of us. So first of all, if I could invite, I'm going to leave you to self-govern and to come up and present your pieces independently, and then we've got some time at the end for questions. So first of all, if I could invite Francis Mortimer, from the Centre for Sustainable Healthcare, and you're going to talk about the UK Kidney Association Sustainable Kidney Care Programme, and this is really an example of great collaboration, so I'm going to hand over to you. And then after that we've got Rachel Soper, good morning, who's from the Students Organising for Sustainability. And Rachel, you're going to talk to us about net zero healthcare from the inside out, about the engagement of staff with the Green Impact Toolkit, which has been a fantastic piece of work. And then finally, Phil from the Royal College of Emergency Medicine, Phil Anderson, I should have said, Philip, in fact, about Green ED. So I'm going to hand over to you, and we've got a clicking clock, so here we go.
Thank you very much, Josephine. So I should say I'm speaking on behalf of myself, but also my co-presenter who's not here today, Suren Kanagasundaram from Newcastle. So the Sustainable Kidney Care Programme was launched as a statement of intent in late 2021, and it's a partnership between the UK Kidney Association, the Centre for Sustainable Healthcare, where I'm from, and the Sustainable Healthcare Coalition. But it followed a series of engagement events where we consulted with patient, industry and multi-professional communities on the scope and the structure of the programme. So the first task was to set high-level targets. Target 1 is to meet or exceed the greener NHS carbon net zero goals. And target 2 that we set is slightly different. It's to meet or exceed the goals for circularity in kidney care. So we've used the time frame for the net zero, the carbon footprint plus target of the NHS, and we're aiming in both cases to exceed these targets using procurement tools such as the social weighting in procurement to drive further progress beyond these targets faster. With the circularity, what we're looking to do is to demonstrably shift processes up the waste hierarchy and shift the onus for waste management away from the end user. So the delivery is via 3 individual work streams. Work stream 1, Action, Learning and Education, has sought to revitalise the Sustainability Champions Network around the country, and we've invited each kidney unit to put forward a champion. And here we come to our first challenge, where so far the scheme was launched this summer, but so far there's 12 out of the 81 units represented, so we're working hard to increase that. But I think one of the things we recognise is that we can't afford anymore to rely on the enthusiasm of grassroots individuals. We risk burning them out. So we desperately need to complement that with systems level engagement. There are some ways we can go about this. We can use the financial savings part of the triple bottom line as an incentive to engage senior leaders across the specialty. But I think that there is a barrier. There's a perception that the increased workload that you need to put in is too much in a stressed NHS at the moment. So there's further work there. We have got another lever in the Renal Services Transformation Plan, which has recently been launched and now requires all kidney care services to have an appropriately skilled and influential member of the team to drive this agenda. Another thing that we have been able to do is bring some external funded resource into the programme, so we were able to at least fund supervision for a cohort of group scholars this year to take forward projects which they'll be presenting at a national webinar next week. But again, the uptake was limited by pressures on the system, so only 5 out of the 10 possible funded supervised posts were filled. The frontline resources, the engagement has included revitalising the Green Nephrology case library and the online network with regular learning and sharing events, launch of a Green Unit guide and a sustainable kidney care course. So workstream 3, I'm going to jump over to and come back to it in a second, is working to develop reporting metrics for renal service water and energy use and waste production. It's piloting this at regional level with an aim to integrate it into national reporting, national audits via the UK Renal Registry. We're looking to influence clinical practice guidelines, and we also have help in the form of tool carbon calculators developed by the Newcastle collaboration. Coming back to workstream 2, this is our major interface with industry. 2 main strands, firstly establishing an industry liaison group, and secondly the original plan was to develop specific joint statements of demand of industry for high impact products in the renal pathway. But actually, in recognition of how resource intensive it is to develop those standards and statements of demand, this has been changed to develop a generic joint statement of demand of industry to provide greener products and services overall and to describe what that looks like. And another change which has taken place, which I think is potentially very powerful, is that we're now integrated with the International Green K work stream on sustainable procurement, which has come about through the International Society of Nephrology. So please do have a look at the Kidney Care Sustainability Network and Case Library on the Networks Hub, and on there you'll also find about 30 other networks for different specialties and professions. Thank you very much for your attention.
Hello everyone. Nice to be here today. My name is Rachel Soper. I'm from Students Organising for Sustainability. We're an education charity focused on sustainability, and we believe that learning has the power to bring about the changes we need to see in the world, and that includes workplace learning, lifelong learning and CPD to ensure that the people in work now are learning and continually learning to solve challenges. And Green Impact is one programme that we run. It's a framework to embed sustainability within teams. And I'm going to talk about Green Impact that we run in healthcare today. The challenge has already been mentioned. We know what the challenge is, that healthcare workers want to take action, but they're busy and they may not know what they need to do to achieve net zero. And we need to see engagement from all roles and areas of healthcare, clinical and non-clinical, if we want to deliver a truly sustainable net zero healthcare system. We know that individuals understand their roles and their specialties best, and they can identify exciting opportunities to reduce emissions and reduce waste, but they're not empowered to take action. They might not feel they're able to just make a change, so we need to empower them. And green plans are great, but they might seem too strategic or high level for individuals to actually know, what can I do in my area of work? So one solution is our Green Impact Toolkit. So it offers healthcare teams a framework and support and learning opportunities to tackle sustainability issues, and it recognises them for making an impact. Healthcare teams implement a set of positive activities relevant to their role using the online toolkit to guide them and track progress. We take a holistic view of sustainability that includes social responsibility, social sustainability, and it runs on an annual cycle, so there's continual improvement. We know that net zero isn't going to be 1 year and we're done. It needs to be continual improvement as we learn more and change how we do things. And it uses research, national net zero targets, green plans, but translates them into simple, achievable and clear actions to support sustainability and quality care. This is one example from our Green Impact Toolkit for dentistry. It runs over an annual cycle where dental teams implement positive actions using the online toolkit to guide them to make progress. Through our various toolkits in healthcare, we run it in across the UK for GPs, across a number of NHS trusts, and the dentistry toolkit. More than 45,000 positive sustainability actions have been completed by healthcare teams and verified by student auditors. And in terms of finding co-benefits for the toolkit, we know that we need to engage staff linking to the number one priority of patient care. We know we're not going to have net zero for the sake of net zero. We need to engage staff with these co-benefits, so obviously linking to patient care, aligning with their values, and highlighting the transferable skills development in CPD. A lot of people get involved in Green Impact to develop skills that they can use elsewhere in their roles and build confidence and engagement with their team. There's that empowerment and agency, a sense that they can make a difference and are empowered to take that action. We've heard about financial savings already, highlighting the potential financial savings aligned with taking action. There's also the important recognition for what's already happening. We don't want to just say, do new things, but we want to celebrate and champion work that's already been doing, because we know lots is already happening, and it's important to recognise those people and share that good practice across the sector. And it's also responding to public and patient demand and expectations. I think we'll see more and more of this over the coming years, where patients are expecting sustainable healthcare, and Green Impact is one way to respond to that. So I'm really excited to meet a lot of you today, talk about Green Impact, and hopefully get lots more people using it to take positive action in their areas of work.
Good morning. Just going to introduce myself. So my name is Philip Anderson, and I'm here to give you a whistle-stop tour of a quite large piece of work that's been going on for the last couple of years within the Royal College of Emergency Medicine. I'm currently working actually as an intensive care trainee doctor up in the northwest of England, but my background is in emergency medicine, and that's how I came to be a part of the Green ED team this year. Normally whenever I give these talks or inductions, I start off by talking about why this is so important, but I think everybody's already got the memo given that we're here today. So I thought what I would do is just talk a little bit about the timeline of the Green ED and how it's come to where it is today. So it really is a grassroots movement that started whenever some highly motivated clinicians lobbied the Royal College to divest from fossil fuels, which they did in the summer of 2019. This group of clinicians then felt that they would be able to achieve greater change if they were campaigning with the voice of their professional representative organisation, and the college then set up the Environmental Special Interest Group. The Special Interest Group then went on to begin the Green ED pilot, which was launched in 2021. The pilot ran across 8 sites through England over a period of 8 months, from the end of 21 into the summer of 2022. And then, using the evidence from this pilot project, we were able to, along with Greener NHS and the Royal College, fully launch the Green ED this year, which is now live. So I think it's probably reasonable now to explain a little bit about what is Green ED. So at its very core level, it is essentially a structured framework which helps to guide an emergency department become more sustainable. You can see on screen we've got an infographic which contains our bronze actions. We've got a bronze tier, a silver tier and a gold tier. The idea being that they're continuous and departments at their own pace can try and achieve these goals and move up throughout the framework. We have on our Green ED website a large amount of material which is open access. It was important to us that the work we were doing was accessible to departments. So on the left-hand side, these are the things that can be accessed via the Green ED website. So there's a comprehensive handbook which contains the rationale about why we're doing this piece of work. And then it also contains our pilot site reports, some infographics, and the RChem position statement. We also do have a subscription which allows departments to, for a fee, get support from the Royal College and the Green ED team. The idea behind that is that from the pilot projects, what we realised was that a lot of the projects appreciated ongoing support and peer support between each other. Similar problems were encountered across similar projects, and we wanted to maintain the grassroots nature of the Green ED, letting clinicians share ideas about what works for them, and hopefully that accelerates change throughout all departments. We also have built the Green ED portal, which allows the department to access action-specific resources and also lets you log your own progress. And it's a facility to let you also look at our cost calculators, which we've built, which will let you see what your equivalent CO2 savings along with your cost savings may be. Importantly, going forward, we also offer accreditation, where over a rolling 6-month to 12-month basis, a team of assessors will look at the work that departments have carried out and either provide them gold, silver or bronze accreditation, which, especially as we move to a net zero NHS, will be increasingly important. There are many other things that I would love to be able to tell you, but within the realm of 5 minutes, I wasn't able to quite get there. So I'd invite you to come and have a chat with me during the networking sessions, and I can talk a little bit more about the cost benefit that we have been able to prove through the pilot project, our eCO2 benefits, feedback that we've had from clinicians, but importantly patients, where we're currently at in the live Green ED project in terms of sign-ups and engagement, the lessons learned that hopefully we could share, which might help other projects, the engagement that we've had from our community, and by that I mean ED clinicians, and also the engagement that we've had from the Royal College. Thank you very much for your time.
I think I'm live, thank you very much. So thank you very much for some fantastic snapshots into the fantastic work that you've been doing. We've now got the opportunity to open to the floor for questions, I believe. But just to summarise, I suppose from my point of view, recognising that the NHS has actually galvanised through Greener NHS relatively recently, it certainly feels to me that a lot of the work that you've been doing sort of predates that and really started from small seeds and through really, despite the fact that we've been through a major pandemic and life does not stop, there has been great momentum that you've gathered in the work that you've done, and that is really about bottom-up, grassroots, energy for change, galvanising through collaboration and advocacy, speaking up and actually moving things along. So fantastic work, and I think really the recipe for a lot of the programmes of work that you will hear about today. So really great work. And I suppose just to sort of ask a first question of you, were there any sort of pitfalls and challenges along the way that you sort of experienced, and how did you overcome those? Because certainly there is this sense, isn't there, that people don't yet feel completely empowered to take action themselves, and certainly thinking about the toolkit, that's helped people to do that, and the collaboration that you've spoken about enables people to be empowered to change. How did you sort of help people to sort of develop that, I suppose? Over to you first.
Yeah. Am I like? Yes. So I think there's a number of issues. I'm going to start with maybe a negative of a challenge we haven't solved, is capacity. And I think everyone will recognise that staff want to take action, but don't have the time. And I don't know how exactly we do solve that, but that is one area that I think is an ongoing challenge that we'll see across the board. However, something that has been incredibly powerful is building knowledge and understanding, because people will make the biggest impact when they feel confident making informed decisions. So providing that knowledge and making sure that people, you're not just imparting information, but really giving them the skills to make decisions is one of the most important things. I think that knowledge building and skills building.
Thank you. Philip.
Hello. Yes. I think actually just going on from the toolkit, essentially what we've tried to do is create a emergency medicine specific toolkit to support departments which we know are very pressed on time, to just streamline so that the challenges that we have faced previously as individual clinicians functioning within departments is accessible to anybody, so you can almost lift up a project and just start it. And that's the idea, is that we've got starter examples of these projects. We've got evidence that they work. We've got evidence that patients like them. We've got evidence of cost savings. So it's literally a lift, take it to your own environment, and then hopefully you're just able to do it. And we've also found one of the things through the pilot project was that having peer support was really, really important. It gets a bit overwhelming. Emergency medicine is incredibly pressed, and being able to interact with other clinicians to essentially share ideas, and just, if something's not going well and you've had a tough month, accept that unfortunately that happens and it's not the end of the road.
Thank you.
Yeah, I very much echo, I think, capacity, and last winter we had some really good projects underway, and people really just had to pause them and go back to their clinical work, and we understand that, and I think that's why we're putting the emphasis on those system levers alongside, so making it part of expectation of reporting and management of kidney units, and also part of the understanding of what good clinical care looks like, so as part of the pathway. So understanding that we can improve patient outcomes by being more preventative, by managing chronic kidney disease well, by transplanting people early so that they don't need to go on to hemodialysis in the first place. There's huge intersection between improving care and improving sustainability, so I think that's really important. And then the other really big challenge is around the supply chain, because hemodialysis has all of these products and they've got long supply chains. And I think it has been difficult for suppliers to really respond. A lot of times they said they're willing to produce things in a greener way, but we've been very incoherent in what we've asked for, and that's kind of allowed them to get off the hook as well. So I think that global approach of, because these are multinational companies, of aligning what our ask is and rewarding the ones who innovate for a greener, lower carbon product or service is really important.
Yes, thank you very much. And I suppose it is important to think about as systems now, as ICBs. We do obviously have an element within the work that we do which does require us to consider sustainability, does require us to consider all of this in everything that we do. So what I've certainly seen is a definite alignment through the programmes of work, but also through the way that we operationalise things within the NHS, and through procurement in particular, is really coming to the fore to link it all together with greater strength. But now is the opportunity to hear from colleagues in the room. I'm hoping that there will be a roving microphone, and it's right at the back there, which gives people at the back of the room, obviously, the head start. Otherwise, we'll get our microphone having to run towards the front. So, colleagues, do you have any questions that you'd like to pose to our fantastic panel? And we have one question here. 2 questions at the front. Thank you. Welcome.
Thank you. So I'm Dr. Stuart Dyksmith. I'm a consultant psychiatrist working in Wales, hoping to produce the first kind of net zero inpatient ward. What I wanted to ask each of you, after a really interesting talk, thank you very much. It was some real great insights that I've kind of been able to note down. But I wonder if you would each have a recommendation for what you would like to see replicated by people outside of your specialty in terms of other institutions, other specialties. What's the key thing that they could take away to try and replicate from the work that you guys have done?
Did you hear? What key thing would we like to take from the learning we've got from the specialties we've worked in?
Yeah, that you think could be replicated by other people in other specialties. What do you think would be the first point to try and take away from what you've told us?
Yeah, I mean, I think for me, again, it would be about bringing it together with improving patient care and the quality of patient experience. And I think I think you're in psychiatry, so I think that there are things we can do around access to green space, for example, and empowerment and recovery models of care that will both reduce resource use from patients kind of chaotically bouncing around and relapsing, and build longer term resilience, and also reduce our care burden on the environment.
I think sort of one of the main lessons that I think is probably appropriate to take forward, regardless of what you're doing, is just collaboration. We've had a significant amount of support from Greener NHS, but we've also built sort of a team which has come from across the country, and having sort of regular meetings and just discussing ideas to then accelerate things forward. I think it feels very overwhelming if you're an individual clinician in a department to try and drive such a large amount of change, and having support from other clinicians, but also people who are dedicated within the college or Greener NHS who can actually point you in directions and sort of say, this has worked in the past for this project, have you thought about X, Y, and Z? It just helps to reduce the sort of the burden and makes it feel all a little bit less overwhelming.
And I would just add, I agree with all of that, that we need to consider culture alongside operational. It's not just about embedding operational activities, but through Green Impact we have a lot around embedding and communication, so that there's a feeling of this is just how we do it here. And so not neglecting that, getting people to talk about sustainability, getting them to put it in team meetings, and it is equally as important as the operational elements, and kind of make it part of onboarding and building that culture.
So I would certainly agree with that. I think that's absolutely right. So connecting with colleagues, being an advocate, being loud about it, connecting with the people that you can when you can, and to use the infrastructure and the sort of the system methodology that you have where you work to sort of bring that to bear, really. We had lots of questions. Over to you.
Thank you. Neil Finer, consultant ophthalmologist in North Surrey. And brilliant talks from everybody, and amazing work that's going on. And thank you very much for that. Something that you've all sort of touched on, and Josephine, you sort of addressed it specifically, was about working with commissioners and the sustainability commitments of ICBs. And I don't know how universal my experience would be, but certainly in my area, working with our commissioners, sustainability has not really featured at all, and the ICB is very focused on bottom line unit costs of treatments, and we know that a few years down the line, this will have changed if the NHS Net Zero plan is to mean anything, that we will be looking at treatments and making decisions about treatments partly on the basis of sustainability. So my question really is, what are the obligations of ICBs towards net zero? How do we engage with our commissioners to ensure that we and they live up to those commitments? And so I'd be interested in your help with that.
Well, I can give you a quick kick-off. And so I would say that, first of all, remember that each ICB has a commitment as its fourth raison d'etre, really, which is around the anchor commitment, and that is around our commitment to our populations, within which there is the element which is around sustainability. I think the second element is, we are really required to have some board-level leadership, both within our organisations but also within the ICB, and it is that leadership role to constantly remind the system around its commitment. I recognise that at the moment it's easy to forget, but it's also important to remember. And I think for my part, the most important element is to try wherever possible to create the confluence between the day-to-day of what you need to do, your financial sustainability, your high-quality, safe care, etc., but also start to quantify it as part of the same equation. Because through delivering some of those things, you will also start to deliver some of your sustainability targets. The key and most important people that you need to get alongside you are your directors of finance. And certainly I think within London Region, we've really worked very hard to make sure that we are drip feeding into every agenda across the piece. You have to just get there and use whichever method you can to make sure that it's on the agenda. So, for example, within London, we now have the net zero goals and targets and green plans of every system as part of our regional assurance meetings with each ICB, so it can't be forgotten. And you begin with a soft approach, but you then start to build it in with a much more sort of, I won't say performance management, but a much more target-driven approach. So it's about doing it every which way, all at the same time. Over to you.
Yeah, I was going to say to use the tools that are already out there. We've got a free-to-access GP's toolkit, and that already exists, and ICBs can engage with that, and their GPs can engage with that, and that already exists. And currently we've got a free-to-access dental one as well, and we hope that will continue next year. But these tools exist and they're available, and we're doing the hard work already. So it's about using that and engaging rather than creating something from scratch, and using what's already around.
I'd just add as well, you mentioned sort of costs is what people come back to, and what we found is that sustainability and cost is it's not mutually exclusive. Quite a few of our projects we look at it through sort of the triple bottom line approach. Deliver cost savings, patient doesn't affect or improves patient outcomes, and deliver savings on CO2 emissions. So it is gathering that evidence, perhaps beginning at a very small scale and a local scale, and then trying to scale that up is essentially what we've been trying to do. But they don't have to be mutually exclusive, really, is the point that I'm coming back to.
Thank you, Philip. I'm going to take one more question, if that's all right. We had another question. Thank you.
Oh, hi. Terry Kemple. I'm a retired GP, but I'm the GP lead for the GP version of the Green Impact for Health Toolkit. So given that our reality is that we are going to be working in a stressed NHS for probably at least 10 years or more, given that actually the people in the room represent a tiny bubble of all of the NHS, 5% maybe, who are trying to make change within that stress system. My question really results from, I was at a conference 2 weeks ago when we had the head of behaviour change in the NHS, giving a great lecture on how to create behaviour change. And we had a great lecture on how important leadership is in the NHS. And then I asked the question, how can we get behaviour change in our leaders? But nobody really seemed to know the answer to that. So I'm just wondering if you've got any suggestions.
Francis, is that a fair question for you? I don't know. I think we are the leaders. You're looking at them. They're in this room. And we have to lead from the position that we're in the system. I think that
leaders equally are people and they can be engaged, and I don't think that my organisation runs board level training now for boards, ICBs and trusts, and many of those people who are attending that training are actually new to the fact that that climate emergency is a health emergency. So I guess the first thing is we're starting to reach them, and I think there's huge credit going to the Greener NHS for setting the net zero targets and the mandating those green plans, because that's why they are coming to the table now. So I think the fact that we haven't reached them to date, and I've been doing this for as long as you, Terry, so I am frustrated, but it doesn't mean that they can't be reached, and I think they are being, and we should work with that.
Colleagues?
It's the golden question, isn't it?
I mean, I can give you a quick stab in 0 seconds. So I would say it's very difficult in an environment such as this at the moment, where we're all very, where politically there's a bit of a sort of confusion over where we are with net zero. I would say that, you know, as clinicians, we are on the brink, if not already, facing some real issues and problems with climate emergency and the health impacts that are arising from that. There's something every day on the news now, which I think is positive in terms of starting to move the hearts and minds of people in general. I think that we have to advocate as clinicians. I think that we have to advocate, we have to make change, we have to lead by example. And before too long, we will actually having to be facing making some real changes to tackle mitigations for climate change within our population. So I think that we're already in that space. The evidence is absolutely there. And so events like this that bring us together as clinical leaders, galvanized around this theme, have to be important. I think we've probably come to the end of our session. I'd really like a big round of applause for our speakers, and thank you to you. Thank you.